Alex, and I'm going to be the first host for Student Feud Rheumatoid Arthritis. So welcome to Student Feud Pathophysiology Edition. In this exciting game, we dive into the world of rheumatoid arthritis, a chronic autoimmune disease that affects millions of people worldwide. Through laughter, learning, and friendly competition, we aim to raise awareness about rheumatoid arthritis while having a blast with our new nursing student peers. Rheumatoid arthritis is more than just joint pain. It impacts daily life in various ways, from mobility changes to emotional well-being. Our game will explore the ins and outs of rheumatoid arthritis, shedding light on its symptoms, treatments, and the experiences of those living with it. Get ready to test your knowledge, uncover misconceptions, and engage in meaningful conversations about rheumatoid arthritis. And I'll let everyone introduce themselves.
Hello, I'm Chelsea.
I'm Selena.
I'm Emma.
So we're going to start first with the pathophysiology of rheumatoid arthritis, and just like the rest of the series of questions, these are all right answers, but they are ranging from a point system of 1 to 4, 1 being the easiest answer and 4 being the most difficult answer. Okay, now, what do plasma cells secrete after being transformed from B cells? So they were B cells before, and now they're plasma cells. So what do they secrete now? What do you think?
Macrophages?
Macrophages? Yes, 2 points. Okay, and what do you think, Selena?
Interleukins.
Interleukins, that is a 1 point. And Emma?
Going for the 4.
Yeah?
Destructive antibodies.
You got the 4. You got the 4. Look at that. All right. Okay. Now, we have 1 more left here that no one got, and it's the 3 point. So, that is the TNF, tumor necrosis factor. So, I'm going to give a summary for why these are the answers for this question. What do plasma cells secrete after being transformed from B cells? And I have this image here to help explain these answers. And so after these 3 steps of the inflammatory process of rheumatoid arthritis, the plasma cell secretes the macrophages, the interleukins, the destructive antibodies, and the TNF, the tumor necrosis factor. And these cause the destructive antibodies, these cause damage to the ligaments, tendons, and cartilage. And then the TNF, the tumor necrosis factor, this is the, along with other things, the substance in the body that causes inflammation. So these 4 are all here. And then the macrophages and interleukins, those are, well, the macrophages are the white blood cells that produce pro-inflammatory cytokines. The interleukins are produced along with TNF alpha and matrix metalloproteases, and these are what incite the inflammation in rheumatoid arthritis. So this is for what's happening down here after the 3 steps.
About the clinical manifestations of rheumatoid arthritis. So let's get started. What are classical joint deformities characteristic of rheumatoid arthritis?
Ulnar deviation of the metacarpals, I think.
So you get 2 points. And Selena?
Swan neck formation.
Okay. And how about you, Emma?
What about
Baker's cyst? Okay, and then the last one was Boutonniere's deformity. Okay, so with with boutonniere's deformity, the finger is flexed at the second knuckle and then hyperextended at the third knuckle. And there's a photo of that here. With the swan neck deformity, the finger's middle joint bends back more than usual, and the fingertip is bent down, and that is shown here. And then with ulnar deviation of the metacarpals, the fingers and the hand are bent outward toward the pinky, and that is shown here. And then finally, Baker's cyst is a cystic nodule that is behind the knee. Okay. And then last question regarding the clinical manifestation of rheumatoid arthritis. So we're going to move on to Emma, who will be asking questions about how rheumatoid arthritis impacts organ systems.
So we're going to be going over the impacts that rheumatoid arthritis has on the body and the body systems. I'll be asking good questions. What disorders can be related to rheumatoid arthritis?
Myasthenia gravis.
Yes, you are correct. MG is a common term for that. Alex?
Anemia.
Anemia. Yes, you are also correct. Anemia. 1 point here for you. And Chelsea, what do you think?
Polyarteritis nodosa.
Good.
Wow.
All the.
You get the difficult ones today.
All right. That one is also worth 3 points. The last one that you guys didn't get is pericarditis. So we'll go through them again, 1 through 4. Anemia can affect the body with rheumatoid arthritis by the unchecked inflammation, which can lead to a reduction of blood cells characterized by headache and fatigue. Also common symptoms that we saw in the clinical manifestations. Treatment consists of drugs to control inflammation along with iron supplements. Anemia, low iron, want to fix that. Next is a myasthenia gravis, also seen as MG. It is a relatively uncommon autoimmune neuromuscular disorder that can occur at any age, but it does create loss of function in some receptors and neuromuscular junction. Autoimmune antibodies directed against muscle-acetylcholine receptors in this disorder. And 3 is a polyarteritis nodosa, which already has been associated with. It's a rare systemic necrotizing inflammation of the small and medium arteries that can occur anywhere in the body. The vascular tissue or the vascular inflammation leads to aneurysms, thrombosis, ischemia, infarction in the body's organs. So more blood vessels related on this one. And lastly is the pericarditis. Pericarditis, which can be caused by. Pericarditis is inflammation of the pericardium and epicardium, the folds of serous membrane that surround the heart's exterior. Pericardium is a tough outer membrane that secures the heart in position. It is attached to the sternum and thoracic structures. So this can lead to inflammation of the heart, all related to just an autoimmune disorder. So lots of different systemic disorders related to rheumatoid arthritis. And we will now be moving on to Selena's part, which is the assessments.
Now on to assessments. When conducting a head-to-toe assessment, what are common physical findings? Emma?
It's painful swollen joints.
Painful swollen joints. That is correct. 2 points. 2 points to you.
Thanks.
Oh, sorry.
Okay. And I think decreased range of motion.
Sorry, I forgot to repeat that. There isn't it. You are right. 3 points for you, Alex. Chelsea?
Joint deformities and contractures.
Great. Lovely. 4 points. Okay, and the last one was subcutaneous nodules. During a head-to-toe assessment for rheumatoid arthritis, common physical findings include joint deformities and contractures, such as Boutonniere deformity, which is when the middle joint of the finger is flexed and the distal joint is hyperextended. swan neck deformity, hammer toes, or ulnar deviation. Painful, red, and swollen joints, which indicate inflammation and active disease, lead to decreased range of motion and grip strength. The exact cause of subcutaneous nodule formation is not fully understood, but they're thought to arise from the accumulation of immune cells and inflammatory substances within the subcutaneous tissue. Other findings include foreshortened hands, boggy wrists, Baker cysts, and peripheral joints, leg ulcers, eye redness, joints that are warm to the touch, pericardial friction rub, and positive Babinski sign. All right, next question. Okay, now moving on to the bonus questions. We'll have 2 questions, each for 3 points. And we're going to be using the bonus spell. Okay, bonus question number 1. What is the most common medication to treat rheumatoid arthritis?
Methotrexate.
Methotrexate, correct. Methotrexate is a first-line therapy and should be prescribed at an optimal dose of 20 milligrams weekly and in combination with glucocorticoids. MTX suppresses overreactive T cell and B cell activity, that is causing joint pain and inflammation. It can be given orally or sub-Q once weekly. Because MTX interferes with metabolism of folic acid must be given. With this regimen, 40 to 50% of patients reach remission or at least low disease activity. Sweet.
All right, so bonus question number 2, final bonus question in the set into our game for 3 points. What is the most common diagnostic tool for RA, rheumatoid arthritis? Oh, okay.
I'm gonna say rheumatoid arthritis criteria specific classification system.
Good enough, I'll take it. So the diagnosis of rheumatoid arthritis is made according to a set of specific criteria developed by the American College of Rheumatology, abbreviated the ACR, and the European League Against Rheumatism, abbreviated EULAR, classification system, and is based on several clinical criteria and laboratory tests. Clinical criteria include the presence of morning stiffness in the joints, polyarthritis, which include the hand joints, symmetrical arthritis, and subcutaneous rheumatoid nodules for a minimum of 6 weeks. So that is the end of our bonus round. Good job, everybody. We're gonna tally up the points and we will be right back. All right, we are back with the scores, the final scoreboard. And last place scoring 20 points is me.
Oh.
I know, tragedy. Next, we have a tie for 2nd and 3rd place. That tie is between Alex and Selena, both starting with 18 points, but each getting 1 bonus for 3 points, so 21. And that means finally our last winner with 27 points is Chelsea.
Oh my
Congratulations! Your prize will be waiting off stage once we conclude our show. Thank you all for joining in on our game. Hopefully you learned some things. I learned a whole lot. With any questions, we have pictures, we have our references. All the information will be there. All right, thank you. Bye.
Thank you. Bye.